to talk about animal reproduction, chapter 11. We're going to talk about canine, feline, and equine reproduction, and a little bit about other large animals as well. So we're going to start with anatomy. Reproductive anatomy includes the entire body system, from the brain and the hypothalamus and the pituitary, to the pineal gland, which is in the brain as well, to the gonads, which are the ovaries and testes, the tubular genitalia, which is a small portion of the reproductive anatomy. It can be male or female. And then the importance of endocrine glands. So all of these endocrine glands that you can see here in this drawing of the cat are actually important with the reproductive system as well. So the thyroid gland, the parathyroid glands, the thymus, the adrenal glands, the pancreas, those are the brain, the stuff in the brain, those are all just as important as the ovaries and the testes. So we're going to start with ovulation. Ovulation is the release of the oocyte, or egg, from the follicle. Once ovulation occurs, the follicle forms a clot, which is called the corpus hemorrhagicum, and progesterone increases. So there are several hormones that are involved in the reproductive cycle, and the one that is important for pregnancy or maintaining pregnancy is progesterone. And one way to remember that is progesterone protects pregnancy. So let's go through this. Here's an actual picture of an egg getting ready to burst out of a follicle. And this is a picture of one that has burst out of the ovary, and underneath here there's a lot of blood in there. So if we look at this, here's our little egg, and the egg separates into a primary egg, and then we have polar bodies that support that primary egg. And here is our little follicle, and you can see that there's a lot of tissue supporting that egg, and it becomes a vesicular follicle, so something like a blister. So you can see this is blistering out until we have a hormonal surge that will cause this to open up, and that egg will go out, and it actually goes really cool into the abdomen and could float anywhere in the abdomen. But what happens is the fallopian tube comes around and grabs that egg, and it goes into the oviduct. Once that happens, this is a bloody mess, and so it becomes the corpus or body hemorrhagicum, bloody body. Okay, as it kind of scars down, it then starts to produce progesterone and becomes what is called the corpus luteum. Corpus luteum is after the egg has lysed out, and that corpus luteum becomes a little endocrine factory that produces progesterone to protect pregnancy. Now, if we do not have pregnancy, or once the pregnancy is over, that CL, or corpus luteum, will regress. And as it regresses, it becomes just scar tissue, or corpus albicans. Albicans means white, alba means white, and so albicans would be little white body. So once it's scarred down, now it can no longer be a follicle, it can no longer hold an egg, and over time, all of the eggs that you have in your ovary will be released at some point or another until we have just leftover scar tissue. So, like I said, there are a lot of hormones that are in control of the ovarian activity. We're going to see these hormones a couple of times throughout your program, but these are really important. So it starts in the brain, in the hypothalamus. There's something called gonadotropin releasing hormone. So gonadotropin means growth, gonad growth releasing hormone. So what does that do? It causes FSH or LH to release based on what's happening within the cycle. So let's start with, we're starting the cycle. Starting the cycle is ovulation, but if we're going to grow a follicle, we need follicle stimulating hormone. So follicle stimulating hormone is encouraged to be released by gonadotropin releasing hormone. So FSH will come down to either the testes if we're going to develop a sperm, or to the ovary if we're going to develop an egg. And it's going to cause the follicle to start to grow. As that follicle grows, estrogen is going to be released. Estrogen is released, and it does a negative feedback to say, hey, you know what? Let's decrease the FSH a little bit. And it goes back to here to say, hey, you know what? Let's get LH going, okay? So as the follicle grows and gets bigger, as more and more estrogen is produced, and the more estrogen is produced, it decreases more follicle stimulating hormone, but then increases the luteinizing hormone. Okay, so over time that overbalances until the luteinizing hormone spikes and the egg is released from the ovary. Once the egg is released from the ovary because of the luteinizing hormone spiking, then progesterone and inhibin is released, and that is going to protect the pregnancy, and inhibit anything else from being released and starting the cycle over again. Okay, and this doesn't happen, it happens in a timeline. That timeline is going to vary from species to species, but all of these hormones are involved in each species. So in mammalian species, this is what you're going to see. All right, so fertilization. Fertilization is when you have the sperm meet the egg, right? And it's going to happen really close to where the egg comes into the oviduct. So right at the junction of the ampulla, which is this cup-like thing that would grab the egg, and the isthmus of the oviduct, so this very narrow channel. Once you have that occurring, and if this egg is going to travel, regardless of whether it's fertilized or not, this egg is going to travel to the uterus, and regardless of what happens, that CL will form. But the CL will regress quickly if you don't have an embryo formed. And the embryo is formed and releases conception factor, or another hormone, once it is implanted into the uterus. So we have fertilization. This first little sperm that penetrates the egg is the one that is the lucky guy. And so we have two nuclei now in here. So one nuclei, which is not shown here, and then we have two nuclei in here. So egg and sperm pronuclei, so two haploid genetic codes coming together to make one diploid genetic code. That becomes a zygote. Okay, so then the zygote starts to cleave and separate and become 2-celled, 4-celled, 8-celled, and that happens fairly quickly until we have a multi-celled organism that is called a morula. This morula develops a little sac around it, which eventually becomes the placenta, and this sac now is called the blastocyst, and that blastocyst becomes implanted in the uterus, and now we have potential pregnancy. Okay, so litter-bearing animals are a little bit different. They have long uterine horns that come to a uterus body, and there will be implanted blastocysts at various locations along each uterine horn. And we'll talk about some differences with litter-bearing animals further on as well. With one thing, the more eggs that you have released, the more likely you are to have multiple offspring. So we're not going to talk about different types of twins or anything like that. What we're going to talk about is just, a sperm and an egg. But the more eggs that you have released, the more likely you are to have multiple offspring. So with an estrus cycle, this estrus, and I'm going to point out spelling here, because when we're talking about the cycle, the whole cycle, we spell it with an O. And so if you think of cycle, you should think there's an O in estrus, okay? It's determined by hormones from the pineal gland. The pineal gland has a lot to do with daylight. So it's connected through nerve cells with your retina that understands the lightening and darkening of days. Okay, so our pineal gland will release animals, not all animals, some animals just cycle year round. That pineal gland will determine when those hormones will be released. Then we have our hypothalamus, which, if you remember, releases gonadotropin releasing hormone. We have pituitary gland, which will release FSH or LH. And then we have our ovary, which will release estrogen, inhibin, progesterone, and our uterus, which will also help to release certain hormones as well. This is an example of a charting of equine reproduction based on what hormones are doing when ovulation is occurring. So an estrus cycle, it's lasting between days 0 to 21. So this is the time of estrus within the cycle. The whole estrus cycle, spelled with an O, is going to last longer than that. So, but within that, there's a heat cycle, okay, and we call that particular heat cycle estrus. In some animals, they bleed during this cycle, and some animals, they bleed after this cycle. So first of all, to get into estrus, proestrus would include when we have estrogen spiking. So if you think about premenstrual syndrome, that's when your estrogen is spiking. That's proestrus, okay? So your estrogen is spiking. As your estrogen is going up, see, remember that FSH increases estrogen. So first you're going to have a couple of cycles of FSH, and then you're going to have an increase in estrogen, okay? As estrogen is increasing, you're going to start to see a decrease in FSH, but then an increase in LH. When LH reaches a certain level, you'll have ovulation occurring. If you are measuring LH to determine when ovulation is occurring, you're going to want to measure in several days. So you may measure LH here, LH here, and LH here. And as soon as LH starts to go down, you know that ovulation has already occurred, and you need to go ahead and breed that animal. We can also measure progesterone. Progesterone will remain high as long as we're maintaining the CL, the corpus luteum. It will remain high if we have pregnancy. So progesterone will stay high during that time. Here's LH, here's FSH. Here's another one called PGF-F2 alpha. This is a prostaglandin, which is kind of not really a hormone. It's a conocytoid. It's a different chemical thing. It's involved a lot within the immune system and the inflammatory system. But this prostaglandin spikes. And when it spikes, it does cause estrogen to start to rise, and you can use this hormone or this prostaglandin. It's called Lutalyse, and it is something that will start this cycle over again. So if we use this at a different point in time, we can actually inject this Lutalyse into an animal and start this ovulation a little bit sooner. So just something to remember, we do use these hormones as ways to manipulate this cycle. Embryo, the oocyte, as pictured in the previous slide, becomes a multicellular blastocyst. When that placenta develops, and I'll go back to that slide, within that we have an endoderm, that's the interior portion of the placenta, and we have the ectoderm, which is the outside of that placenta. Two words that you need to understand: superfecundation means multiple sires of 2 or more offspring in one gestation. Dogs or cats or litter-bearing animals can have multiple fathers of that litter. That means mom is continuing to ovulate even after you have one implantation of an embryo. Superfetation is when the dam conceives again while still pregnant. So that goes with superfecundation. So superfecundation has to do with having multiple sires. Superfetation has to do with the mother being able to conceive again. One thing that I have to point out, if you're thinking this through, is that because of receptivity and ovulation, if mom is able to conceive while already pregnant, and you can have multiple fathers during this short time period, 1 to 3 days, you could have offspring that are as much as 5 days apart in development. So if you think about that, when you have one or more fetuses that are ready to be born, and they're sending the signal that they're ready to be born, and mom starts to go through labor, you may still have a fetus in there that is 5 days behind in development from the other fetuses. And so that might be what we call the runt of the litter. It could also be an animal that is of a different father as well, so that may be smaller than the others. So there are some runts that are perfectly normal. They're just a little bit behind, a few days behind, a few days premature versus the others. So they'll grow to the same amount. Or you may have an animal that's a runt because they develop poorly, or they have a different sire. So there are lots of reasons why we may have what we call runts in a litter. So here we go. Here's estrus cycle. So the whole cycle, and you're going to need to know how this progresses through. Okay, the whole cycle has an O in the term. When you look at estrus, that is the time of sexual receptivity and mating. Okay, so shorter period than the whole cycle. Puberty is what we call the time of first ovulation. It's when GnRH is released, which stimulates FSH from the pituitary, leading to that LH spike. Proestrus is the time leading to estrus, so it's when estrogen increases. Estrus is that time of sexual receptivity and mating. Diestrus is the time of pregnancy establishment. Parturition is giving birth. Anestrus is the time when the female is not undergoing any reproductive events. For females that have a seasonality to their estrus cycles, this would be horses, goats, sheep, cats, and dogs. They have a seasonality to it. So there are times when they're not going through heat cycles. Okay. You should know the information, all of the information in tables 11.4, 11.5, and 11.6. In male reproduction, we do have similar hormones. So we have gonadotropin-releasing hormone, we have follicle-stimulating hormone, we have estrogen, inhibin, and luteinizing hormone. Estrogen is in lower amounts than you would see in females. Females can have something like testosterone as well, but again, it's lower amounts than in males. Spermatogenesis, how are sperm formed? So with females, all the eggs are within the ovary at the time of birth. With males, they develop sperm at puberty. It starts with spermatogonia. Spermatogonia have the normal number of chromosomes in their nucleus. Sperm have half the number. Okay, so a spermatogonia will lead to 4 mature sperm. Do it through mitotic divisions, so they develop a twin of themselves, and then they go through meiosis, which is developing a half of themselves. They go through two mitotic, because if you start with a primordial germ cell, go through 3 mitotic divisions. From the spermatogonia, it's 2 mitotic divisions, 2 meiotic divisions, and they become a sperm. The final form is a early spermatid that differentiates kind of like a tadpole differentiating into a frog, where they have if you look at it, they have this nucleus within the sperm cell. The sperm cell develops a tail that is covered by a plasma membrane. It is connected, the head and the tail are connected by a midpiece, which is made up of mitochondria. If you know what mitochondria are, they are the energy powerhouses of the cell, and this is what propels the tail. There is a small neck in between those two. The head has the nucleus, and it also has a tip that has an acrosome on top of the tip. That acrosome contains digestive enzymes that will eat away at the membrane of the egg so that the sperm can penetrate into the egg. It is really important that when you are looking at live sperm, that you are seeing all of these components and they are all formed correctly. If they are not, then the sperm has a very difficult time in its journey to where it needs to fertilize the egg. Here's a picture of a cross section of a seminiferous tubule where you see the spermatogonia starting at the very outer edge and going towards the seminiferous tubule where the sperm will travel through the vas deferens and into the female. Breeding can be either natural or artificial insemination. Naturally, we want to see, usually, especially with dogs or cats, days 2 to 4 after the luteinizing hormone or LH spike, or if our progesterone levels reach 2 nanograms per milliliter. We do want to do daily assays, but they can be expensive. Progesterone can be another tip-off as to when they're ovulating. Knowing when the animal is ovulating is especially important for artificial insemination. For natural, if you have a dog, they will be able to understand when the bitch is in heat and be able to breed appropriately. Artificial, we can do it vaginally, surgically, or transcervically. We can insert a sterile straw into the animal and get the sperm in there. We can use fresh or frozen semen, but we do need to thaw to a proper temperature. There are certain precautions when you're dealing with semen because semen is very fragile. It will be killed by blood. It will be killed by rubber. It will be killed by getting too warm. So we have to be very careful with how we treat that semen. Gestation, or how long does it take for a dog to be born? For a dog, or a cat, it's usually an average of 63 days. It's a 60-day gestation, but the thing is, you don't know how long it takes for fertilization to occur. It can take anywhere from 1 to 7 days after they've been bred or after ovulation and breeding. So any time during that time, so it's exactly 60 days gestation, but if they didn't fertilize at the time when they bred, you don't know when they're going to have that baby, those babies. So diagnosis, how are we going to diagnose that they're pregnant? We can palpate them. If they're thin animals and small animals, usually palpation at about 2 weeks, we can start to feel these little bubbles in their uterus. If they're larger animals, and we have to wait until the fetuses are larger. Ultrasound, we can usually ultrasound and see heartbeats at about 2 to 3 weeks of age. X-rays, but it's difficult to count offspring when you're looking at that because things will move and you have to know exactly where your location is at the time. X-rays. We do X-rays in bitches that are coming due. They have to be after 45 days of gestation. Why is that? Well, we cannot see anything that is not bone, right? Or mostly bone. So the denser the tissue it is, the easier it is to see, and fetal bones don't develop until 45 days. At 45 days, we can see the skull and the spine, and so we can start to count how many offspring there will be in the animal. I like to do x-rays as close as possible to when we think they are due because it will give me a good idea as to the measurement of the skulls of the fetuses versus the size of the animal's pelvis to make sure we're not going to have any issues as the animals are born. Placenta. Every species has a different attachment of the fetal placenta to the uterus, and with these litter-bearing animals you will see a zonary placentation. This is where all the blood vessels are, and this is where the placenta is attached to the uterus. Those are important things to remember. So you can see this is a ovary, this is a uterus that has been removed from an animal, and these are fetuses within the uterus. You can see the zonary band, or that belt that's around each placenta, or each fetus. Parturition in dogs is called whelping. Stage 1 lasts 6 to 12 hours, but can last up to 36 hours. During stage 1, they'll be restless, they'll start to nest, they may stop eating. You'll start to maybe see some uterine contractions, but you may not see an abdominal component, so they may not be actively pushing or seeing that abdominal contraction. Stage 2 is when the puppies are delivered. This takes about 20 to 60 minutes per puppy, so it can take anywhere from a whole day, depending on the size of your litter, or just a few hours. If you're seeing more than an hour between puppies, there may be an issue, and at that point you want to make sure that the owner knows to contact the veterinarian. Stage 3 is when placentas are passed and the uterus returns to normal. Now placentas, because they are zonary and around each puppy, often will come out with the puppies. That doesn't always happen, but all placentas should be passed. Mom usually eats placentas, which is really good for her, so you don't often see the placentas passing, but it is important that those all come out. For cats, so some reproductive terms that you should know: queen tom kittens. A spayed female is when the gonads and uterus are removed. You can just ovarectomize a female. That's when hormones, but it does leave the uterus intact. There are benefits and risks to leaving the uterus within them. Queening is when you have delivery of the fetuses. These guys are long daylight length breeders, so they breed anywhere from January to October when we start to see an increase in daylight. Their puberty is dependent on photoperiod, age, and weight. So if you have an animal that is 4 to 5 months of age at the end of October, they're not going to come into heat until 6 to 7 months of age. But if you have an animal that is 3 to 4 months of age in January, they may come into heat right away. So usually at about 4 months is the earliest we'll see, but I've seen them a little bit younger than that. So you could have a female cat at 6 months or younger giving birth to kittens. It does have to do with weight as well, so they do have to be a little bit greater than 50% of their adult body weight. They are induced ovulators, so this is a difference, and you'll need to know about this. Cats, rabbits, and ferrets are all induced ovulators, which means they don't get an LH surge for ovulation unless they have copulated, meaning they've had sexual intercourse, and that's the only time that they will ovulate. It is daylight dependent, so they are long daylight breeders. Their estrus behaviors include increased vocalization, rolling, lordosis, treading in place, anorexia, and spraying. They will continue in estrus for a long period of time if they are not induced. So if you have an indoor cat that is going through estrus and showing these behaviors, it is important to get her spayed right away. Breeding is best at day 3 of estrus. LH is released within 10 minutes of copulation. So once they have copulation, within 10 minutes they'll have ovulation. The primary hormones are FSH, LH, progesterone, which is P4, estrogen, which is E2, prolactin, which releases milk, and relaxin, which is helpful during parturition when we'll have to relax ligaments to get the fetuses out. Okay. Average length of gestation, about 63 days. Where are they fertilized? Same place as everyone else in the oviduct. Feline parturition, stage 1, stage 2, stage 3, very similar. You're in this case, in stage 1, the difference is you may start to see fetal movements and lactational secretion. Stage 2, dystocias are really rare in cats. Usually they can self-assist. They're delivered fairly quickly. Stage 3, placentas are passed and the uterus returns to normal. For horses, some common terms: mare, filly, stallion. Cryptorchid is when you have a retained testicle in the abdomen. All testes start in the abdomen close to the kidneys where the ovaries are located, and then are pulled into the scrotum as they age. A colt versus a foal. Sometimes young foals are called colts regardless of whether they're fillies, which is a female foal, or colt, which is a male foal. Foaling is when they have the offspring. Weanling is an animal that is weaning. We have geldings, which are castrated males, and then you can spay or ovarectomize a mare. It is more of a significant surgery, an expensive surgery. It's not done very often unless there's a medical condition. The equine estrus cycle, they do get their first ovulation between 12 and 24 months. Their peak estrus activity occurs near June 21st, so they are long day breeders. We can change this, and I'll tell you why and how we might do this, and it has to do with hormones and light and temperature, because they are seasonally polyestrous. They'll go through the estrus cycle set every 21 days, or 21 to 28 days through the long season of the year. So if light and temperature have an effect, but also nutrition and stress can have an effect as well. We can refer to the estrus cycle as going through their follicular versus their luteal phase. They do go through a diestrus phase when they are either preparing for pregnancy or not ovulating at that particular time. In order to figure out when they are going through an ovulation or when they have ovulated, we have these things called teasing methods where we might put the mare into a stock so that she can't kick out, bring a stallion in if the stallion is showing interest, and then the mare shows interest by putting her tail off to the side and showing that she's ready to be mounted. That will tell us that she's in heat, ready to be bred. Ovulation occurs 48 hours before the end of heat, so that can be hard to tell when are they going to end their heat, but they can also have a silent heat, so they could show no signs of heat whatsoever. There's a 12-hour window post-ovulation where you want to breed them, so it's a very short window. The CL is functional for 5 days post-ovulation, or possibly 8 to 9 days from the onset of heat. So they're going to go into heat, and within about 2 to 3 days, we want to breed these guys and make sure that CL is functioning. The cervix should be closed once the CL starts to regress, and then we should have progesterone decreasing if they don't have a pregnancy about 2 weeks after ovulation. Mares have a tendency to decrease the progesterone regardless of whether they're pregnant or not, and so often we have to supplement them with progesterone to maintain that pregnancy. Again, we can use lighting and hormones to manipulate the cycle. And now, why would we do that? Well, there are certain breed associations that have age requirements, and they designate January 1 as the birthday for all horses born in a given year. So there's pressure to have foals born early in the season, so in January or February. This can mean that a horse born in January is as much as 6 months older than a horse that's considered the same age, which doesn't make a whole lot of difference if you're talking about a 16-year-old horse, but when you're talking about a 2-year-old horse versus a 1.5-year-old horse, and remember we start racing at 2, that can make a huge difference. Keep that in mind. That's the reason they might do that, especially in thoroughbreds. So generally what we see is there is a human-imposed breeding season starting February 1 through July 15th because it's an 11-month gestation period. And so they're trying to have those foals as early as possible in the year. Lighting and hormones are used to manipulate this cycle. When we have a breeding mare, it's important that we do a reproductive tract examination on her to make sure that she's going to stay healthy. It's hard enough to keep these guys pregnant, so we want to make sure that she's going to stay healthy through the whole pregnancy. I do have a video for you to watch that talks about looking at the conformation of the vulva, making sure that their dorsal opening to the vulva, the top opening to the vulva, is at or below the pubic bone. If it's above the pubic bone sticks out a little bit and creates a shelf on which poop, because the poop comes from above that, can sit and cause infection within there. So that it kind of tells about the conformation there. Also, when we're doing an examination of the reproductive tract, we do want to properly prepare that area, make it nice and clean. We don't want to introduce anything into the reproductive tract that can cause problems. We're going to wrap or tie the tail so all the hair is away from that area. We're going to wash that area with soap. We're going to use a sterile lubricated speculum, being very gentle and trying to gain access to and look at the vaginal walls as well as the sphincter. I've just pulled out some of the things she talks about within that video. There are different ways to inseminate and breed a mare. We can do artificial insemination, which can be a little bit safer for the mare because when you have two large animals together, they can cause damage to each other. But there's also live cover where you have an actual stallion mounting and breeding a mare live and in person. Why would we want to choose one versus the other? With artificial insemination, we have some controlled circumstances. We have much less likely to cause disease or stress or damage to the mare. But also, we have to consider that there are breed standards. Certain breeds do require that the animal is live covered. So we have a stallion event. One of the most common breeds that I think of when we think of live cover as a requirement, that would be the thoroughbred. For pregnancy, the equine placenta has attachments throughout the entire chorioallantoic membrane. We'll talk about chorion and allantois coming together on the ectoderm of the placenta within our anatomy and physiology course. There are 6 layers of tissue, pretty much with all placentas, between the blood of the fetus and the dam, so that allows for protection between the two. We do diagnose pregnancy through ultrasound. There is a great variability in gestation. They can be pregnant anywhere from 320 to 360 days. That's 40 days different. That's over a month difference. So we want to be really careful that we don't induce parturition with oxytocin in a mare that is less than 360 days, because if we have a premature foal, they are not likely to survive. So we want to make sure that they're bagged out, they have colostrum in their mammary glands, that we're seeing relaxation of the ligaments, that we do have cervical dilation before we do induce them. A normal parturition does have those 3 stages. They're going to be restless first. They're going to either want to, depending on the horse, they're going to either seek you out or they're going to go away from you. Stage 2 is really important for these guys. It's very short and it begins with a rupture of the chorioallantois. The fetus must be outside once the water breaks. The fetus must be outside within 70 minutes for them to survive. So we want to really observe them carefully for signs of distress. I had a friend that called me a couple of years ago. She had a horse on her farm that they weren't sure when she was due. They actually didn't know that she had been bred. They did notice that the water broke one morning and that there were 2 hooves sticking out, which is appropriate. The animal should be diving out of mom with 2 front hooves and a head following it in a diving posture. Well, he had 2 front hooves sticking out, and it had been 20 to 30 minutes already. So I immediately got into my car because they were 20 to 30 minutes away. Once there, we prepared to receive, and we continued to watch the mom. Nothing happened for another 10 to 20 minutes. And she was pushing and nothing was happening. So at that point, we knew we were 65 to 70 minutes out. We had to get that critter out. We were able to get the foal out within the next 5 minutes, and the foal did just fine. But that's the kind of thing that you have to be prepared for and be very ready to step in if necessary. Full heat, mares can go into a full heat within 2 to 18 days. It kind of cycles everything back up again. It is not recommended to breed them at their full heat. Here's an example of a picture of our 2 little hooves sticking out, and here's the nose of the foal, and she is pushing pretty hard. Not all of these guys lay down to go into labor. Many of them will remain standing, and the animal will hit the ground pretty hard, so it's important to have good bedding down. One other and I have a video that you can watch as well to see how quickly this process is. One other thing that I will say is you might think that those hooves could cause a lot of damage in the uterus and on the way out, and they could. So what you actually will see is these hooves will be covered with a feather-like membrane that softens the hooves and keeps them from causing any damage. So for cows, heifer is a female bovine younger than 2 years that's never had an offspring, so heifers. Cows, bulls, steer is castrated male bovine, a calf and calving. Those are the terms you need to know. Gestation is 283 days or 9 months. First calving is desirable at 2 years of age. First pregnancy is desirable at 15 months. So at 15 months, we get them pregnant, and by 2 years of age, they're having offspring. Polyestrous, they are polyestrous. They have a similar cycle to a human. They do have a short estrus period where they're receptive. It's about 18 hours. So anywhere from 6 to 24 hours, the average is 18 hours. So we have to check them for heat 3 times a day when we know they're coming into a cycle. Oftentimes, a group of cows will be put into a similar cycle by given injections so that they're all coming into heat about the same time, so that it decreases the amount of times that you're going to need to check for heat. Mating behaviors, the male will mount. But what we can do is we can use that mounting behavior to check for heat, and I'll explain that in a minute. Their estrus cycle, they cycle every 21 days. They're in heat for 6 to 24 hours, and they typically will bleed after ovulation. So usually by the time we're seeing blood, it's a little bit late. We do refer to them as two types of cycles, either follicular and luteal phases, follicular being when the follicles increase, luteal being when the CL develops and progesterone rises. Or we can refer to it as estrus, medestrus, and diestrus. Medestrus blood is seen in vulvar discharge within 3 days of heat, and it's too late at that point. Insemination, we want to inseminate, and typically with dairy cows, these are artificially inseminated. With beef cattle, a lot of times we'll have a bull in the pasture at the time that they're going through heat. We want to inseminate them approximately 12 hours after the cow is observed in heat with frozen or fresh semen. Obviously, with frozen semen, we're going to warm it up prior to. We can use heat detector patches, and this just detects if they've been mounted. And we have these little cameras up here that can indicate if an animal is in heat, and we can identify that animal and get them inseminated. Their gestation is usually about 280 days or 9 months. They have a unique placentome cotyledonary attachment of their placenta to the uterus. Ewes and does, goats have the same thing. They're just shaped a little differently. It's kind of like a snap, your genes snapping into place. Convex and a concave side that snaps into the fetal placenta. The uterus has these little buttons on them, or snaps, that snap into the fetal thing, and that's where the blood is transferred. The side that's on the cow is the carbuncle, and the side that's on the placenta or the fetus side is the cotyledon. We can diagnose bovine gestation by palpation. That's rectal palpation. We can actually feel if they're ovulating so that we know when it's time for them to be inseminated. And we can also feel if they are pregnant. Ultrasound, we can use an ultrasound rectally to see if they have been if they're pregnant. Their parturition, they do have stage 1, which is 6 to 24 hours, where you'll see cervical relaxation, uterine contractions, and then a Ferguson reflex, which is relaxation of the perineal area. We will see stage 2 at 2 to 12 hours, will last 2 to 12 hours, where you'll have the rupture of the chorioallantoic membrane, that's the water breaking, and you'll have release of oxytocin, which helps with uterine contractions, and that PGF2 alpha, prostaglandin. The fetus is delivered in stage 2, and stage 3 in cows, it's different. It lasts about 3 days to weeks when the placenta is passed. So everybody else needs that placenta passed pretty quickly. With the cows, they do need to have the placenta passed, but it can take a little bit longer, and the uterus will then return to normal. Ovicaprine is sheep and goats. Ovine is sheep. Both sheep and goats are seasonally polyestrous. They have a 5-month or 150-day gestation period. So their season to go into estrus is 5 months before their offspring are due to be born. Offspring are usually born in the spring, so 5 months before that is going to be in the fall. So October through December typically is when they're bred. Puberty is solely dependent on body weight. So once they're 60 to 70% that of an adult, they are ready to be bred. We call them ewes, rams, and wethers. Anything younger than a year is a ewe lamb or a ram lamb. Their estrus cycle, again, they're polyestrous. They're short day breeders. September through December is their primary breeding season. Their estrus cycle lasts about 16 and a half days. So every 16 and a half days, they're going to go into a heat, and their ovulation is about 24 to 30 hours, so a day or so after the start of going into heat. We can use body condition scores to determine if they're healthy for pregnancy. If they are overweight, any ruminant that is overweight can get something called pregnancy toxemia, which is very dangerous for the animal. So we want to be very sure that they're at a proper body condition. The mating behaviors, rams will usually be able to tell when the ewes are pregnant, and so if you're using a ram, it's really easy. It's a lot more difficult to artificially inseminate these guys, but you can do it. We can synchronize estrus cycles by using hormones. Some methods of detection, if they've been bred, we can use these little chalk harnesses, and so if they're mounted, they will get a little chalk on their back, and it will tell us that they've been at least bred. Once we know that they've been bred, we can check with an ultrasound. We can use serum progesterone test. It's not a pregnancy test, but it can tell us if their progesterone levels are higher than normal. So for goats specifically, we talk about does, bucks, wethers, kids, and kidding. Estrus cycle is 21 days, usually about 18 to 21 days, will depend on the breed, and the estrus lasts for 1 to 1.5 days. So within a day or so, we need to go ahead and breed them. Ovulation is comparable to a ewe, and they have estrus behaviors that have to do with being around a buck. A buck odor and pheromones can stimulate those does to cycle earlier than if you don't have a buck. So if you're artificially inseminating or relying on bringing a buck to the area in order to breed them, you want to do it sooner rather than later. Not everybody likes to keep bucks on the property because they are very smelly and they urinate on their beards, so they're pretty nasty little animals. They can go into anestrus during summer as daylight lengthens, but they don't always. There are some breeds of goats that will go through estrus cycle year-round. Those are primarily Nigerian dwarf goats. Goats, when they're in heat, and sheep will do this as well, they will flag their little tails, they will wink their vulvas, they will call out more, they may have some discharge from their vulva as well. Camelids, camels, llamas, alpacas. They go into puberty, females 10 to 12 months. Males are not able to breed until the adhesions of their penis to their prepuce break down. So adhesions keep the penis within the prepuce and don't allow it to extend, and they need to be able to extend it in order to breed. And that doesn't happen until they're about 3 years of age. Their estrus can last up to 36 days. They tend to show similar signs as to being in estrus. They show a signal to the male that they're ready to mate. They do mate lying down, as pictured here. Their pregnancy is 340 to 350 days, and it is a lot harder to keep them pregnant than any other animal. Mares are really hard. Camelids are even harder. Their termination rate is 10 to 50%. When camelids give birth, it's called unpacking, and they unpack a cria, C-R-I-A. This cria is the baby. Stage 1 only lasts for an hour or two, so you have very little time to get ready. Stage 2 only lasts for 20-30 minutes, and then you have a fetus on the ground. Within an hour to 4 hours, we should have the placenta on the ground. If it's not out within 6 hours, we want to treat with oxytocin. So this could all happen at night, and you need to go looking for that placenta to make sure that it's gone. Ovulation and fertility will return at 20 days of postpartum. With males, we can also do a breeding soundness exam. There are different ways to collect semen. It's a little bit unique with cows. We use an electrode to go into the rectum to do electroshock, and that electric shock causes stimulation and ejaculation within a few minutes. And this a video that will show how that works. We are looking at a number of different reproductive characteristics plus the semen quality. So we want to look and make sure that conformationally they're okay, they're able to mount and penetrate the female. Also that their attitude, you're going to be able to work with them. Their disposition, that they have libido. Not every bull wants to mate, so they must have the the need to mate with females, and just looking at all their systems to make sure that they're normal or passing on good genes. We do a scrotal examination. The size of the testes in these animals has a lot to do with their ability to mate. So we want to measure those and compare those with normals. Different species have different shapes of their penises, and so looking at that, making sure they're normal, and then looking at the semen. Remember, we have to make sure that those sperm are moving in the proper manner, in a forward motion, they're not going in circles, and that they look normal as well. When we do look at semen, we need to look at semen fresh. We might look at a frozen sample that's been thawed to make sure that they're still doing okay. And when we look at it, we need to use a heated stage. So this is called a stage on the microscope. We need to make sure that that is heated to 37 degrees Celsius. I'm going to say that 2 more times. 37 degrees Celsius. That is the body temperature at which sperm are most active. So it needs to be at 37 degrees Celsius to make sure that those animals are maintaining proper motility. For females, we talked a little bit about how we would do that for a horse. We do want to get reproductive and health history. We want to prepare for a vaginal examination like I showed in that first video. We want to make sure we're not contaminating that area at all. And we may want to get an endometrial biopsy, which is a biopsy of the uterus. It can tell us a lot. If there's a lot of scarring in there, that can tell us that we may have issues with pregnancy. All right, so that is what we have for the reproductive tract. There are several things that I pointed out during this lecture that you may want to go back and double check, make sure that you understand. Look at your book, the tables in your book, and make sure you understand all that terminology. Let me know if you have any questions.